Mr. President,
The senator from Hawaii.
I ask unanimous consent to speak for up to 15 minutes.
Without objection, so ordered.
Thank you, Mr. President. Mr. President, I rise to speak on the Affordable Care Act. At home in Hawaii, we have a saying, "Lucky you live Hawaii." That can mean a lot of different things to different people, but when talking about access to affordable, effective health care, this phrase has particular meaning. In the early 1970s, the rate of uninsured in our state was about 30%, meaning that roughly 1 in 3 in our population would live in fear that a sickness or injury could cause financial ruin for themselves or their families. The people of Hawaii knew this was unacceptable, and in 1974, the state government passed an innovative piece of legislation, the Prepaid Health Care Act. Now simply known as prepaid, this legislation required employers to provide affordable and quality care for hundreds of thousands of individuals and their families. Now our uninsured rate is one of the lowest in the country, with only 8% of our population lacking any type of insurance. So even though Hawaii has been at the forefront in making health care a right and not a privilege, we still have a ways to go. Even with prepaid, there are more than 100,000 people in our state still uninsured. When the Affordable Care Act passed 3 years ago, I knew it meant that those who are uninsured or underinsured in Hawaii would find some relief. We've already seen major successes since this landmark legislation has passed. Yet people are still afraid of Obamacare. And that's because a lot of people have spent a lot of time and money to make the American public believe that somehow this legislation is bad for them, will harm them. That's why when asked about health care reform as a whole, many Americans say they are concerned, they have anxiety. But when you talk to people back in Hawaii and across the nation, and even those who think they don't like health care reform, they like what it does. For example, parents like that they can keep their children on their health insurance until the age of 26, which affects 6,000 young adults in the state of Hawaii. People will no longer have to live in fear of lifetime limits on health benefits, which will help 460,000 residents of Hawaii, including 115,000 children. More than 500,000 people in my state will no longer have to worry about being denied coverage because of a pre-existing condition. And as a state that has committed to the Medicaid expansion, Hawaii will also now be able to provide care to close to 68,000 more residents, starting in 2014. People like these policies. People like what health care reform is already doing for them. And while my colleagues across the aisle are looking to repeal this historic legislation, I'm looking forward to how we can build on its success. Let me be clear, the fact that health care reform is working and is exactly why the detractors of the ACA are trying so hard to stop it from being fully implemented. They know that the American people are embracing Obamacare because of all the good it will do for our families. In particular, I'm looking forward to the opening of our marketplace, the Hawaii Health Connector, on October 1st. Many people I've spoken to want to know what the marketplace may mean for them. Simply, the Hawaii Health Connector is going to provide a consumer-friendly way for residents of my state to view and compare a wide variety of plans. Then they'll be able to pick the coverage that best suits them and their families. My office has been in constant contact with the Connector, and their staff in Hawaii has been working tirelessly to set up the online and phone interface and to provide assistance and navigation in the form of kokua, a word in Hawaiian that essentially means pitching in to help your neighbors and your community with no regard for personal gain. That's reflective of the values we have in Hawaii, that everyone deserves to be healthy and have access to affordable and quality care. Now, that doesn't mean we don't still have a lot of work to do. I'm hoping that a number of bills that I've introduced, including the Rural Preventative Healthcare Training Act and the Strengthening Health Disparities Data Collection Act, will be considered and voted on by the full Senate in order to solve some of our worst issues in providing care to rural and underserved populations in Hawaii and across the nation. But I believe ACA is working the way it should be. It is increasing the number of insured Americans, promoting preventative care that will help to reduce the human and financial costs of avoidable illness, and lowering the cost of care for everyone. Many of my colleagues here in the U.S. Congress choose not to see any of this. The only option for them is total repeal, with zero tolerance for open discussion or compromise on this landmark legislation. But that kind of thinking is what causes the gridlock that Americans are so tired of. I understand that there will be parts of this law, which is a sweeping piece of legislation, that will need to be amended over time to resolve any kinks. These kinds of revisions have been done with every other landmark domestic social policy that has been passed in this country, including Medicare and Social Security. I'm willing, as are my colleagues on the Democratic side, to come to the table and work with Republicans to make necessary improvements over time. But I refuse to engage in the process of political and parliamentary gymnastics designed to score small, short-term wins at the expense of the American people and the economy. It's got to be pointed out that anyone who wants to grind the entire government to a halt over the implementation of this several-years-old law will cause harm to the economy, cause harm to their communities, because federal funding provides essential services and programs to constituents in every state, in every county, and every district. If improvements or changes need to be made, they can be done through the regular order, with hearings, serious discussions, and bipartisan support. Ultimately, what we are seeing in Hawaii and across the nation is that President Obama's historic health care package is making inroads in improving our health care system. And efforts to stop that cannot be tolerated by members of Congress and the people of this nation. I'll continue to support its full implementation and look forward to working with all of my colleagues in the Senate to build upon its success. Mr. President, I yield the floor and note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.